But do you think more of your clients are Democrats than Republicans?
Oh, I have no idea about that.
I'm not sure about that.
Because I'm just wondering if it takes an open view of, I mean, because in truth, you know, conservatism has its origins in independence.
Well, outside of Northern Virginia, I mean, we're in Northern Virginia, but outside of Northern Virginia, there are a lot of Republicans and conservatives, and they're having babies. There's midwifery practices all across the state.
Right, so
midwifery practices across the state.
Right, I guess what I'm saying is it's not necessarily I mean,
It's not a party
not.
line.
No.
But the thing is, it is about, you know, the ultimate empowering of women in this, I think, in a lot of ways.
And we all cross party lines when something's coming. When we were putting forth the legislation to have certified professional midwives become legal, people didn't care what party you are as long as you were contacting your legislator and explaining to them why they had to make CPMs legal in the state of Virginia. We all got together. No one cared whether you were Republican, Independent, Democrat. We all came together because the point at that point it was about having home birth to remain legal and to have an educated person there at the birth.
Now, where are you guys as far as prenatal testing and, you know, finding out what sex the baby is? Because it's interesting, in your own birth, it was like, oh, and by the way, honey, it's a boy.
Well, something that I learned actually after I was pregnant and had my son was that ultrasounds are not even recommended during pregnancy, period.
But it's like standard procedure.
It is.
That doesn't mean it's evidence.
I'm not.
Exactly. So a lot of people don't know that. They think it's routine, normal, and fine. I'm not saying
It's
either
considered
way.
very low risk.
Well,
We don't
not
know.
yet.
We don't know
And the
that.
reason is that it's too soon to know. We will not know the effects of ultrasound until many years to come. And so it's really an unknown right now.
At prenatal appointments, you probably saw, I'm guessing that they used a Doppler during prenatal appointments.
Yeah.
To hear the baby, and I don't even like to use that because, again, we don't know the safety of the Doppler. I have been, at times, when trying to find like a smaller baby, you know, a newer baby,
Right.
that the babies actually move away from the Doppler, and you gotta get a message from that.
That's
and
right.
that's just not one time. That's when I have done that, and the babies are still small enough to move away from the Doppler. Think like 12 weeks or so when we're trying to determine whether the pregnancy is still going or not, and we're trying to find a heart rate. And then when I do, the baby is literally moving away from the Doppler. You have to honor that.
Right.
And that's a form of ultrasound. So I like to practice, as most midwives, evidence-based. I like to have an evidence-based practice.
What do you mean by evidence-based?
I want studies, good studies, not just regular studies, and I don't want just, well, that's because that's the way we do it. I want studies to show my clients why we're doing something. And if you look at the Department of Health and Human Services, the government's Health and Human Services has a branch called the Agency for Healthcare Research Quality, something to that
Right.
effect. So I go there a lot because they look at the research and they look at it unbiased. They're not getting paid by the obstetricians, the midwives, they're being paid by no one but the federal government. And they've looked at, for example, ultrasound and haven't found it to be safe. They haven't found it to be unsafe, but they haven't found it to be safe. I think parents should know that.
What is driving all these ultrasounds?
Oh my
Money.
God, they are money makers
Yes, so
and liability.
I mean, is it go back to control? We want to know the position of the baby. We want to know if it has his arms, his legs.
well, partially, you know, perhaps doctors want to know what they're getting into once labor begins. However, we
Is it
do
the
have
fear that a baby's not going to be perfect? Is that what it's about?
well, on the parents' side, a lot of their reasons for getting ultrasounds is to make sure the baby is healthy, which I can understand. But we have to understand that the revenue for a hospital, the entire hospital, 60% of the revenue is from births.
No. Something?
Yeah.
Mm-hmm.
So,
Really?
right. Isn't that shocking? Because in my view, birth
Really?
is free. I mean, almost free, besides paying your midwife. But seriously, you can have a baby at home or, as many people do around the world, out in the fields or most, if we look at, non-industrialized countries around the
Right.
world, look at the way they're giving birth. And even in industrialized nations, in the Netherlands, 70% of women give birth at home. It's the norm.
Really?
And so, and it was the norm until we medicalized it here. But when you look at that statistic, 60% of a hospital's revenue is from birth.
That's just shocking. I'm surprised.
Yeah. So now you get to look into why they're doing all these procedures and interventions. Well, they're driven by money.
Because, I know, Tammy, you have a page about mothers who've lost their babies. You do some comforting in this. Am I correct? That was a pretty moving thing. That's part of, it's part of life. Not everything works, not everything makes it. But how do you feel about people who screen for, if they have a possibility of Tay-Sachs or Down syndrome or something, or if they're older? Because, let's say you need to do amniocentesis over the age of 40 or something like that, which I would think would be probably like a third to half the babies being born now.
Yeah, and there are risks involved. That's
Right.
the thing you have to weigh when going in for a test like that. In some cases, it quadruples the risk of losing the baby just doing an amniocentesis. So it really comes down to the parents making that decision. Actually, I don't know if that's enforced. Tammy, I don't know if you know that, but over a certain age, I guess it can't be mandatory, but
Recommended or something.
recommended.
Oh, sure. I mean, I see women under 30 getting the nuchal translucency and a blood test, which try to figure out the rates of trisomy babies.
Getting another call.
Oh, excellent.
Let's take it. Hello? Hello? Yeah, let's see if we can get you on the air here. Let me push the right button and we'll see what we can do. Hold on. What's your name?
Tiffany?
Okay, hold on, Tiffany.
Here we go.
Hi, are you on the air? Can you hear me?
What's that?
Hello, Tiffany, are you on the air?
I can barely hear you.
All right, let's see if we can blow it up a little bit there. Can you hear me better now? I'm trying to avoid distortion. We can hear you.
Okay.
Did you have a question for Stephanie or Tammy?
I started just going to talk about it, I guess.
What did you want to speak about? Did you want to tell a story, or are you having?
Background noise for some reason.
We were doing better on the last call. I'm wondering if is that better?
I can kind of hear you.
Oh well, I'll try to talk very loud. So,
Okay.
did you have a question for my guests?
I do not have a question, no.
Have you ever had home birth?
I have had a home birth, yes.
How many kids do you have?
I have 2 children.
And were they both born home?
I birthed one at home.
Was that the first or the second one?
The second one,
Oh, all right. And what led you to do a home birth?
what made me want a home birth?
Yeah.
My hospital experience was horrible.
What was it?
And-
Yeah. What was it that you wanted from the home birth that you didn't get in the hospital?
Well, they made me take Pitocin at the hospital, and I had to wear a hospital gown. I wasn't able to eat. I didn't.
That's an interesting thing. They just came out the other day. I don't know where I heard it or read it, and I was surprised to think about this, but at a hospital, since at any moment they're ready to operate, you can't eat because they're worried about you throwing up and breathing in throw up or something like that. But as one person put it, it's like going on a marathon and not eating or drinking.
Right. Well, I was eating a steamed burrito up until I gave birth with my second, so.
Did you say you were eating a bean burrito while you were giving birth?
Yeah.
Wow.
Yeah,
Awesome.
it was pretty full. and I was 9 centimeters, and